Hypoglycemia and anxiety are two distinct conditions that can sometimes share similar symptoms. Hypoglycemia is characterized by abnormally low blood sugar levels that can lead to shakiness, sweating, confusion, or rapid heartbeat, while anxiety often presents with feelings of nervousness, restlessness, a sense of impending doom, and also rapid heartbeat. Timely consumption of carbohydrates can provide immediate relief for hypoglycemia, whereas anxiety typically requires a combination of therapy, lifestyle changes, and sometimes medication. Recognizing low blood sugar levels with a glucose meter can guide the appropriate treatment for hypoglycemia, while anxiety may necessitate a psychological evaluation for a proper diagnosis. Risk factors for hypoglycemia include diabetes management issues, certain medications, or critical illnesses, whereas anxiety risks can involve stress, genetics, and various environmental factors. Here's a detailed look at the nuanced aspects of hypoglycemia and anxiety. Symptom origin, metabolic imbalance for psychological response. Hypoglycemia and anxiety can present with surprisingly similar symptoms, such as palpitations, tremors, sweating, and dizziness, which can complicate the differential diagnosis. Hypoglycemia is caused by low blood sugar levels, leading to physical symptoms as the body tries to signal the need for fuel. It requires dietary management or medical intervention to maintain blood sugar levels. On the other hand, anxiety stems from a psychological response, potentially triggered by stress or a disorder. It often necessitates psychotherapy, medication, or a combination of treatments. Although both conditions may present with parallel symptoms, their origins are distinctly different. One metabolic, the other psychological, necessitating tailored approaches for accurate diagnosis and appropriate treatment. Primary manifestation, physical, glucose levels versus emotional, stress response. Hypoglycemia presents with physical symptoms like shakiness, sweating, confusion, and fainting due to low levels of glucose in the blood, which is essential for proper brain function. Conversely, anxiety primarily manifests with emotional or psychological symptoms, including excessive worry, irritability, and a heightened stress response, which can mimic or exacerbate certain hypoglycemic symptoms. This overlap can make differential diagnosis challenging. It's crucial to measure blood glucose levels to confirm hypoglycemia. Notably, the body's stress response to anxiety can also trigger a release of glucose from stores in the liver, leading to fluctuations that complicate the clinical picture. Addressing anxiety might not correct hypoglycemic events, but managing hypoglycemia can alleviate some anxiety-related symptoms, underscoring the intricate connection between mental and physical health. Typical presentation: shaking and confusion versus nervousness and worry. Hypoglycemia and anxiety can present with overlapping symptoms such as shaking and confusion for the former versus nervousness and worry for the latter. Shaking in hypoglycemia is typically a physiological response to low blood sugar, causing a release of adrenaline that stimulates tremors. Confusion arises as the brain is deprived of glucose, its primary energy source. Conversely, nervousness and worry in anxiety stem from excessive vigilance and apprehension of the mind, activating the body's stress response. While both conditions can induce a fight or flight response, discerning them involves considering contextual clues, like timing relative to meals for hypoglycemia or triggers of stress for anxiety, to accurately diagnose and treat. Trigger factors: dietary intake versus stressful stimuli. Hypoglycemia and anxiety may present with overlapping symptoms such as palpitations, trembling, and sweating, but differentiating them lies in recognizing their triggers. Hypoglycemia often results from dietary factors. Missing meals or an insulin imbalance may cause a sharp dip in blood sugar levels, resulting in these physical manifestations. Conversely, anxiety is typically triggered by stressful stimuli or perceived threats, triggering the body's fight or flight response, which can mimic hypoglycemic symptoms. Identifying the root cause is crucial. While a quick carbohydrate snack might resolve hypoglycemia, managing anxiety requires a different approach, such as stress reduction techniques or psychological support. Treatment focus: glucose stabilization versus anxiety management. In addressing hypoglycemia versus anxiety, it's imperative to distinguish between the physiological and psychological treatment approaches. Hypoglycemia, characterized by dangerously low blood sugar levels, demands immediate glucose stabilization for patient safety. This includes consuming fast-acting carbohydrates and, in severe cases, administering glucagon or intravenous glucose. This treatment is straightforward and quantifiable, aimed at restoring balance to the body's metabolic state. Conversely, anxiety management requires a more nuanced, personalized approach. Psychological therapies such as cognitive behavioral therapy, CBT, medication like SSRIs or benzodiazepines, and lifestyle modifications, including stress reduction techniques and regular exercise, are critical for managing anxiety. The focus here is on identifying triggers, developing coping strategies, and possibly altering neurotransmitter activity to mitigate the anxiety symptoms. Each condition, while potentially presenting with similar symptoms like tremors or palpitations, necessitates a distinct therapeutic pathway to address the root cause effectively.